You're seeing a patient with a red, painful eye, and you're pretty sure they have a scratch on the eye, but you're busy. You have chart notes to do, you just got another consult, and it seems like everybody needs something from you. You don't even have time to use the bathroom. Shall I continue? If you need a moment to take a step back and look up how to manage a corneal abrasion, this is the video for you. Now, there's different treatment styles and flavors, but if you follow these steps, you'll have a solid go-to approach that you can use day or night. I'm Dr. Alana Jasper-Trotter. I'm a board-certified ophthalmologist, and in this video, I'm going to lay the framework for how to manage a corneal abrasion. If the eye is overall healthy, the corneal abrasion is going to actually heal on its own and do so pretty quickly. But while the patient is going through the storm, the corneal abrasion storm, the overall goals are managing symptoms, prevent an infection, and determine the follow-up. When should the patient see an eye doctor? Let's get into the how. What do you need to know? So the first step in management is lubrication. Lubrication sitting. There's a little bit of a tangent, but bear with me. You know when you sit down at a restaurant, most of the times you're going to have a salt and pepper, right? If you're cooking, you're going to have salt and pepper in the kitchen. Salt and pepper are the basics that you're going to be adding while you're cooking. Well, in ophthalmology, lubricating drops, specifically preservative-free artificial tear eye drops, that's the basics. That's what you're going to sprinkle on. That's the liquid gold that, when in doubt, artificial tears. So for the regimen, you can have the patient use over-the-counter preservative-free artificial tear eye drops QID+. So I'm purposely saying QID+ because 4 times a day, that's just the minimum. As long as they're preservative-free, there's really no limit. The patient can even use them every 5 minutes if it's soothing for them. Because these eyes can be pretty uncomfortable, you can have the patient use an ointment as needed. Now, this could either be a prescription ointment, which we'll get into shortly, or an over-the-counter artificial tear ointment. The labeling might say nighttime gel or PM ointment, but it's not restricted to the evening. They can use it whenever. So to provide some guidance, you can have the patient use an ointment 1 to 4 times a day as needed, at least at bedtime. So the way that I think about it, very frequent lubricating drops during the day, then at bedtime, ointment as needed. Now, anytime you have a patient using ointment, remind them it's going to blur the vision like crazy. I'll save you a phone call. And here's a trick. Have the patient put the lubricating drops and the ointment in the refrigerator. It'll cool them and it'll feel really nice on an irritated eye, and the patient's going to love you. So the next stage of management is using a topical antibiotic. A corneal abrasion is not an infection, but it is an infection risk. So you can have the patient use a prescription eye drop and or an ointment QID for about 4 to 7 days, depending on the size of the corneal abrasion, the patient presentation, and risk factors. Now, how do you know whether to use an antibiotic eye drop or an ointment? Well, let the severity of the symptoms help guide you. So the more the severe presentation, go with the thicker lubrication with the ointment. You also want to keep in mind if they have any risk factors, because if they do, that's going to narrow down on the specific type of antibiotic eye drop, which we'll talk about next. So let's first talk about in a situation where there's no risk factors. Let's say the degree of symptoms are mild to moderate. For the topical antibiotic, have them use an eye drop QID. So these are some examples of commonly used antibiotics. Now, let's say they're really symptomatic, they're super uncomfortable, just go ahead and upgrade to an ointment, erythromycin ointment QID. Now, it's helpful to know when you're managing a patient whether or not they have a risk factor, because if they do, you're going to want to have them use a fluoroquinolone eye drop, and a go-to is moxifloxacin QID, aka Vigamox. So some examples of risk factors: patients who wear contact lenses. So many people these days wear contacts, and it does put them at an increased risk for an infection, and you want to have anti-pseudomonal coverage, and that's where Vigamox comes in. Other risk factors include a monocular patient. If in the good eye they have a corneal abrasion, they're at higher risk because now they're dependent on one eye. Other risk factors include an injury due to a dirty injury. So a fingernail injury, poke to the eye, let's say there's a mechanic, there's a metallic foreign body, etc. If a patient has mild to moderate symptoms, they can use Vigamox eye drop QID. But if they're really symptomatic, add an ointment to the Vigamox. So you still need them to use a fluoroquinolone because they have a risk factor, right? So they're at higher risk for an infection. So Vigamox eye drop QID, and then you can add an ointment like the over-the-counter artificial tear ointment or erythromycin ointment 1 to 4 times a day as needed. Anytime you have a patient use both an eye drop or an ointment, have the patient first put an eye drop in and then wait a few minutes before putting in the ointment. So we talked about lubricating drops and topical antibiotics. There's a couple other things that you can have the patient do to help them weather the corneal abrasion storm. So you can have a patient use a warm compress where they gently apply an eye compress to the closed affected eye 3 to 4 times a day for about 10 minutes at a time as needed for comfort. Now, this should be warm, as if you're at a spa and it's relaxing. It shouldn't be scalding hot. One, you can burn the skin, so don't want that. But two, it shouldn't be like, oh, this is unbearable. It should be relaxing. It should be soothing. And when you have something that happens to the eye, it can be scary and it can be really uncomfortable. And imagine laying down on the couch, putting the eye compress, closing the eye. It kind of slows things down a little bit. So not only is it soothing to the eye, but it can also be, I'm about to say, soothing to the soul. Okay, we're going to keep going. And for pain management, in addition to the frequent lubrication, put it in the fridge, warm compresses, you can have the patient use over-the-counter Tylenol or an NSAID as needed. So let's say we're seeing a contact lens wearer with moderate symptoms. For symptom management, frequent lubrication, preservative-free artificial tear eye drops, QID+, and an artificial tear ointment at least at bedtime as needed, both of which the patient can increase. Warm compresses as needed, as well as over-the-counter NSAID or a Tylenol as needed. The key in this example is the fact that the patient wears contact lenses. So that puts them at an increased risk of an infection, specifically a pseudomonal corneal ulcer, and those can be nasty ulcers. So to help prevent that from occurring and to protect the eye, you're going to want to have the patient use a fluoroquinolone eye drop. And a good go-to is Vigamox eye drop QID. And have the patient follow up with an eye doctor within 24 hours. So when should you call ophthalmology? Well, I talk more about that in another video that's hopefully popping up on the screen, so be sure to check it out. All right, let's make today a good day. Click that subscribe button, and I'll see you in the next video.